How to have sex during pregnancy. Sex during pregnancy can be daunting, but many women find it just as satisfying as it is at other times. Unless your doctor tells you otherwise, it's safe to have sex right up until your water breaks. However, there are certain practices and positions you may want to change in order to have a more comfortable experience. If you want to know more about how to have sex while you're pregnant, keep reading. Part 1: Knowing the Basics. 1. Talk to your doctor about the need for any precautions. Sex is safe during pregnancy, provided you have a low-risk pregnancy with few complications. Your doctor will let you know if you should avoid sex for any reason at all. You may be advised to avoid sex if you have experienced the following: unexplained vaginal bleeding, leakage of amniotic fluid, history of premature labor, other medical conditions. 2. Know that sex during pregnancy is usually quite safe. One of the most common concerns of mothers and fathers, is that sex will hurt the baby, or that they might bump into the baby during sex, but in reality there is no reason to worry. A woman's cervix forms a barrier between her uterus and vagina, cushioning the baby and preventing harm from occurring. Most women can enjoy a healthy and fulfilling intimate relationship throughout their pregnancy, right up until their delivery date. Consider bringing up the issue of having sex while pregnant during a prenatal visit to the physician. A little reassurance from your physician that sex will not hurt the baby may help both people feel more comfortable. 3. Understand how sex can feel different when you're pregnant. Since pregnancy increases blood flow to the pelvic area, many women feel increased sensation in the clitoris during sexual intercourse. Some women find this pleasurable, while others find it uncomfortable. The following changes may also be present: a feeling of fullness after sex, abdominal cramping after sex, sore nipples, increased vaginal discharge. 4. Know that orgasms can cause uterine contractions. These types of contractions do not lead to labor, but if you're experiencing them for the first time, you might get confused. Orgasms are unlikely to trigger labor, so there's no need to avoid sex on these grounds. 5. Practice smart sex. The same practices that apply to sex at other times apply during pregnancy. If you have more than one sexual partner or are at risk of contracting an STI, be sure to use a condom each time you have sex. Putting yourself at risk of infection may put the baby at risk as well. Part 2: Having comfortable sex. 1. Choose a position that makes it easier for both of you. If you and your partner are interested in maintaining a healthy sexual relationship during pregnancy, then you must be wondering what positions will work best for you as your belly grows and expands. The best thing you can do during your pregnancy is keep an open mind and be creative. You'll probably need to try out different positions and experiment a bit to find something that works for both of you. Most women will find that it is uncomfortable to enjoy sex in a missionary position after about the first or mid-second trimester, once the stomach starts getting big. Try being the one on top instead. Many find that having intercourse in a spooning position is a very comfortable way to have sex while pregnant. Try sitting on a chair or on the edge of the bed while your partner kneels or stands. Getting on your hands and knees while your partner enters from behind is another position that works for many. 2. Use lots of pillows. Pillows are your friend when it comes to having sex while pregnant. Use them under your bottom or other parts of your body to prop yourself and get more comfortable. If one position doesn't seem to be working out, try modifying it by using pillows to achieve a better angle. 3. Try alternative forms of sex. Mutual masturbation can be a satisfying and low-key alternative to vaginal intercourse, and many women find it more comfortable in the later stages of pregnancy. Others find that oral sex is a good alternative to vaginal intercourse, since it requires less movement on the part of the pregnant woman. During oral sex, make sure your partner does not blow air into the vagina. In rare cases, this could cause an air embolism to form and potentially harm the baby. If your partner has oral herpes, a dental dam should be used during oral sex. Anal sex is not recommended during pregnancy, as it can lead to an infection that could spread to the vagina. 4. Go easy on yourself. If sex just doesn't feel good during pregnancy, there's no need to push yourself to do it. Some women find it uncomfortable to have sex during pregnancy, and others experience a reduced sex drive. Do what feels right for you, and make sure you communicate your needs to your partner. Tips. The best way you can ensure that you and your partner remain close during your pregnancy is to check in with your partner on occasion. Inform them of your needs, let them know where you are coming from and what you need or want from them. Warnings. Avoid sex during pregnancy if your doctor advises against it.